Question number 12, which of the following is the most likely diagnosis? And then we see just a bunch of repro stuff. So we know this is a repro question. Easy. This is why we do this. Next up, let's start at the beginning. 29-year-old woman presents the ED with lower abdominal pain and vaginal bleeding. Began several hours ago, crampy and primarily on the left side. That's really important. Always pay attention to laterality if they localize pain to one side or the other, or if it's bilateral, because that's super important in helping you narrow down the diagnosis. So it's moderate, intermittent, blah, blah, blah. Like a lot of this is kind of filler. Last menstrual period was 6 to 7 weeks ago, but is unsure. She has not had any prenatal care. That's also important. Looks like the vitals are within normal limits, maybe a little tacky, mild lower abdominal tenderness without rebound or guarding. Okay, no rebound or guarding tells us there's no peritoneal signs, so probably no viscous organ rupture or abdominal organ inflammation like an appendicitis. Moderate blood in the vaginal canal with a closed cervical os. And then the urine pregnancy test is positive. That's always important too. So we have ovarian torsion, ruptured corpus luteum cyst, ruptured ectopic, incomplete abortion, threatened abortion. Okay, so the abortion ones are always good to think about because these are pretty similar. And this topic is a memorization topic, like the types of abortions. I would recommend knowing those though, because they can definitely help you rule out a lot of answer choices. On test day, ovarian torsion is a peculiar one, but let's start with the basics here. We have left-sided. We're going to use logic to try and get as many of these out as possible. Left side. So we have to have something that is unilateral. Ovarian torsion, is that unilateral? Yes. So that meets our criteria. And we're going to do a diagnostic approach. I like this method. Sometimes when you're not sure, you can give things points, ascribe a point system. So ovarian torsion gets 1 point. Ruptured corpus luteum cyst, sure, why not? That's unilateral. Ectopic could be unilateral. Incomplete abortion and threatened abortion. All right, here's our incredible potato uterus. I'm really good at drawing potatoes, apparently. This dashed line is midline. We said left. So, right, we got our patient's right and our patient's left here. Let's say we had an intrauterine pregnancy. This is midline right here. So how would that present with unilateral pain? It wouldn't. So yes, you could have the closed cervical os. You could have blood in the vaginal vault. You could, but it's probably not going to present with unilateral pain. And also an incomplete abortion presents with an open cervical os. All right, so that's your open cervical os. Threatened abortion is the closed. Incomplete is definitely out because that would be open. Threatened is probably out because, again, we don't have, midline pain and the threatened abortion might not even present with pain. Okay, so just on that one finding, the laterality, we ruled out 2 answer choices. Pregnancy test is positive. Let's go to that one. Would any of these present with a positive pregnancy test? There's only one of these that would present with a positive pregnancy test, and that's your ectopic pregnancy. I just want to show you one more thing that's super important here. This is actually, I say pathognomonic for this condition. For ectopic is the timeline here. 6 to 7 weeks ago is when she had her last period. That timeline, about 6 weeks, 6 to 8 weeks, I've seen, they love asking that time frame. So I would honestly make a flashcard on that. Grab a flashcard, say 6 to 8 weeks, last menstrual period, unilateral pain equals ectopic pregnancy. Make sure you know that time frame. This alone could have gotten you the correct answer.